Are you convinced to use ivermectin? Watch this video. You will not regret. This is Doc Marl at your service. A video circulating in the social media presented a study showing a significant reduction in the number of COVID virus after being treated with ivermectin. The study was done in the laboratory, in a petri dish, not in human beings. What happens in the laboratory may not be true if applied to humans. Therefore, we cannot use the results of this study alone to prove that ivermectin is effective in preventing viral replication in humans infected with the COVID virus. In fact, the authors of that particular study recommended further investigation for possible benefits of ivermectin in humans. The video also presented a study comparing the incidence of COVID-19 among countries using ivermectin as COVID prophylaxis and those that do not. The study showed significantly low incidence of COVID in countries that use ivermectin as prophylaxis compared to countries that don't. However, the study has the following weaknesses. First, it did not mention whether the countries included in this study have functional surveillance system for COVID. Poor COVID surveillance system will lead to low detection of COVID cases, hence low incidence rate. Second, it did not also mention the level of implementation of COVID mitigation measures, such as wearing of mask, social distancing, etc., which may also influence the incidence of COVID. Third, we don't know whether those who did not get COVID were the ones taking ivermectin prophylaxis or simply following the minimum health standards. We call this an ecological fallacy or bias. Therefore, the result of this study alone could not reliably support the use of ivermectin as prophylaxis for COVID.
Does ivermectin reduce mortality among patients with COVID-19?
A study published by Chest Journal revealed that patients with severe COVID treated with ivermectin have lower mortality compared to severe COVID patients without ivermectin. The biggest limitation of this study is that patients in the ivermectin group received more steroids compared to the non-ivermectin group. Because of this, it is difficult to determine whether the observed low mortality was due to ivermectin or steroid. Because of the methodological flaws, the authors of this study recommended randomized controlled trials to confirm their findings. In another study, a randomized, double-blind, controlled trial, neither ivermectin nor hydroxychloroquine decreases mortality among COVID patients with pneumonia treated with these drugs. There were other studies that explored the effect of ivermectin on mortality among COVID patients, but the utility of their results were limited due to defects in study methodology. Based on these observations, there is no conclusive evidence to support that ivermectin can reduce mortality among patients with COVID.
Does ivermectin improve clinical outcomes of COVID patients?
There are studies that show no significant improvement in the clinical outcomes of COVID patients given ivermectin. These clinical outcomes include resolution of symptoms and duration of hospital stay. There are also studies that show significant improvement in the clinical outcomes of COVID patients given ivermectin. So, what is the problem of ivermectin? Conflicting results from low-quality studies is the main problem of ivermectin. It is for this reason that the Department of Health, World Health Organization, Food and Drug Administration, and PSMID do not recommend the use of ivermectin for prophylaxis or treatment of COVID. Many of the current studies have low numbers of participants, weak study designs, and inconsistent ivermectin dosing regimens, given the absence of reasonable evidence. The risk-benefit analysis dictates that We should be prudent in using ivermectin. Uncertain evidence may lead to uncertain treatment results. Thanks for watching. See you in my next video episodes. Bye.